Hi, I'm Dr. Deepthi, consultant plastic surgeon, Eternelle Aesthetics. So today I'm here to explain about all the expectations that you are supposed to have or know after your 360 degrees liposuction. The surgical time for 360-degree liposuction could be somewhere around 3 to 4 hours or sometimes 5 hours depending on the patient's expectations and the needs. Each procedure is customized according to the patient's specific requirements. Immediately after the surgery, as you come out of anesthesia, there'll be kind of drowsiness and a little recovery time for you to get back into complete alertness. As soon as you're alert, you could feel a little mild pain here and there because you're still on the painkillers effect immediately after the surgery. As the effect of painkillers weans off, you would start feeling a little more pain, but we doctors are here to take care that you will not have to bear an unbearable pain or any kind of discomfort. The amount of painkillers are planned customized to the patient and seeing that you're not in the danger zone also. You would most likely go back home on the same day, or you might need 1 day's admission in some circumstances. From the next day on, for my patients, I have always advised to be back to their routine as immediately as possible. You will feel pain definitely because it is a surgical procedure, but you're still on the effect of painkillers. We might give you around twice or thrice or sometimes 4 times a day depending on the specific needs of the patient. The patient will start seeing some bruises here and there around the areas of the liposuction done. You will see edema, that is kind of fluid filling into the areas that we have done the surgical procedure, and all this is absolutely normal. For some patients, the bruising might increase on the day 2, that is 48 hours after surgery, which is a cause of panic for few of them, but I say that's absolutely normal and please don't panic. But try to see your surgeon once in the first 48 hours because this is the time that the surgeon can observe any unwanted changes in your skin or on your body during that time, and which you might not be able to understand, and the surgeon is a better person to understand which is right and what is wrong. You will be advised a pressure garment while leaving the hospital, and it is very ideal to use pressure garment right from your discharge time because this first 48 hours is the time when there is fluid accumulation into the areas of the surgery, and this is not kind of desirable for wound healing. So the pressure garment prevents the accumulation of fluid or any unwanted blood leakage into the areas of the surgery, and this will help in faster healing and easier recovery. From day 3 on, the bruising will start coming down. We expect reduction in edema under normal circumstances, and you'll start feeling a normal looking appearance from around day 4 to day 5. The one big thing that I tell for my patients after liposuction is you will start to have numbness in the skin wherein we covered the areas for liposuction for around 2 to 3 months from almost day 1. This is something which is unexpected of and is very common in post-liposuction cases. Please understand that this is an absolute normal course of recovery, and this numbness is not a mode for any kind of panic. You will gain back your normal sensations within almost 2 to 3 months. The first 5 days after surgery, you will be under good amount of painkillers, you will be advised antibiotics, there will be some antacids and a few medications which will help in healing and faster fluid disposal. Please take all your medications on time as advised by your surgeon and have a good normal diet. First few days is good for a soft diet, but please recover to your normal diet as early as possible. This will in fact enhance your healing. Coming to activity levels, from day 1, please try to be on your feet and don't think that you have had a major surgery and you have to be on bed rest. Coming to cases, especially after liposuction, bed rest is not a great option because you're more on the bed, the chances of retaining the fluid of the surgery is higher. So it is always advisable to be on your feet immediately after the surgery, that's in a day or so, and then get back to your normal routine as early as possible. Of course, keep the activity a little moderate or maybe a low intensity activity, but try to return back to your normal routine as early as possible. The first 1 week of surgery is usually a little more manageable because you're still on painkillers. From the second week on, as you're weaned off from your drugs and painkillers, you might start feeling a little more pain because now don't have a painkiller coverage. The pain that you experience after liposuction is not like an incision kind of a pain, it's more like a heavy gym activity that you have done and a kind of muscle soreness that you'll experience. And this is absolutely normal, and please get in terms with this because this kind of pain might exist for 1 to 2 months, but it is not going to disturb you on a day-to-day basis. For the entire first month, we still advise you to wear your pressure garment all through the day, and after your first 1 month, you can slowly start weaning off the pressure garment or maybe wearing it only in the night or any 12 hours that you're comfortable with. After the second month and the third month, please get back to your normal activities like your gymming activity or any high intensity activity as early as possible, and it is not going to hamper any of your results. By the end of third month or in some cases fourth or fifth month is when you'll actually perceive the final result. Till then, you might see some lumps and bumps in the surgical areas, and this is absolutely normal. Please like and share, and for further queries on this topic, post in the comments box. Subscribe to Eternelle Aesthetics for further information on surgical procedures.